Overview of the National Health Workforce Registry. The Global Strategy for Human Resources for Health, Workforce 2030, envisions attaining universal health coverage and the United Nations Sustainable Development Goals by ensuring equitable access to health workers within health systems. This is because the level of functionality of health systems is dependent on the availability, accessibility, acceptability, and competencies of health workers. Achieving these require equitably distributed health workers with the right skill mix that are motivated and empowered to improve service quality and ensure effective service coverage. Thus, the need for readily available health workforce information for evidence-based planning and management. Nigeria has been reforming the health sector to address the growing health needs of the populace and improve its health indices, which have been suboptimal over time. These reforms have the mission of ensuring that the Nigerian populace have universal access to comprehensive, appropriate, affordable, efficient, equitable, and quality essential health care through a strengthened health system. Human resources for health is one of the priorities, with the goal being to have in place the right number of skilled, motivated, competent, productive, and equitably distributed health workforce for optimal and quality healthcare service provision. This further reinforces the need for health workforce information at various levels of governance and administration for planning and management. The National Health Workforce Registry Policy Amendment 3.2.5 mandates the establishment of a web-enabled National Health Workforce Registry, which shall serve as the national platform for accurate and timely information on health workforce in Nigeria and provide up-to-date information on all health workers under the employment of national and subnational entities and link them to administrative units, facilities, etc. To support the operationalization of the policy declaration, the National Health Workforce Registry Operational Guidelines was approved by the 57th session of the National Council on Health. Previous efforts at developing a National Health Workforce Registry resulted in multiple systems that were not interoperable with each other at the various submitting entities, that is, the 36 states and the FCT, and 14 regulatory bodies. Integration at the level of the Federal Ministry of Health was not achieved. Also, there was duplicity in costs, with each submitting entity bearing costs of hosting information on different platforms, and these were not sustainable as the systems ceased to exist afterwards. This informed a review of the architecture to align with those of other existing health information systems in the country, like the District Health Information System. With the current structure, there is one National Health Workforce Registry managed by the Federal Ministry of Health, with all submitting entities having access to health workforce information pertaining to them only. With support from World Health Organization and funding from the Government of Canada through the Global Affairs Canada, a National Health Workforce Registry and some guidance documents, including the Standard Operating Procedure, Basic User Manual, Advanced User Manual, Disaster Recovery Plan, and Implementation Guide have been developed. The National Health Workforce Registry is an electronic and web-based information system that is domiciled and administered by the Federal Ministry of Health. The registry is the single and authoritative source of authenticated and validated health workforce information in the country. It provides an accurate count of all health workers across the public and private sector in Nigeria, as well as those working in the diaspora. The registry is designed using an open source iris managed framework that is accessible online using all devices and interoperable with other health information systems. It is a multi-site system with one system instance in one central server, and the system houses all submitting entities, that is, the Federal Ministry of Health and its departments, agencies, and parastatals, the state ministries of health and its departments, agencies and parastatals, regulatory bodies, the private sector, etc. Validated health workforce information will be collated, aggregated, and centralized through a bottom-to-top process from subnational levels, regulatory bodies, and training institutions to the national level. Health workforce information from the registry provides the Federal Ministry of Health and other relevant entities with evidence-based human resources for health information to support decision-making and policy formulation.